Hi, this is Dr. Neal Schwartz. Today I'd like to share with you some dental tips and tricks that have served me well. I'm now 44 years old and have not had a tooth pain, tooth sensitivity, or dental bill in the last 30 years. I'll try to avoid the obvious stuff like brushing twice a day, flossing, and rinsing, and instead indulge the nuance and the mad science, as always. Quick disclaimer, today's tips are my personal favorites. They don't represent the standards of medicine, and it's always take it or leave it at your own risk. Again, at your own risk. Tip number 1 is the touch-up. Sometimes we don't have time to fully brush our teeth, and just a little water and the toothbrush midday can keep us ahead of the 8 ball and really help us in our prevention and feeling fresh. You can squeeze in a couple touch-ups a day, and they're so fast and so easy that they actually get done. And that's the key to tip number 1. Tip number 2 is that I use the medium strength bristles. Now I know that many dental professionals prefer the soft bristles so you don't rip your gums off. But for me, after a week or two, the soft bristle toothbrushes get too soft. They kind of mush around and I don't feel like I'm getting clean at all. I use the medium strength bristles and I'm a little more mindful to not rip my gums off, particularly in the first week. That's when those medium bristles feel a little extra firm. After that, they kind of fall into the sweet spot and I prefer it. Tip number 3 is that I love the dental pick, particularly the metal round one with the sharp point. If you combine it with a magnifying mirror, you'll be able to watch as you remove the tartar that's cemented to your teeth. I highly recommend it and I highly enjoy it. But again, try not to be reckless and take these tips at your own risk. Tip number 4 is to use fluoride. I know there's a lot of conspiracy theorists out there and those with very emotional beliefs about fluoride, and that's fine. They're entitled to their opinion, whether it be scientific or not scientific. My opinion's also not scientific, it's just my personal preference. I think fluoride is helping me not get cavities, and completely anecdotally and unscientific, every friend and family member I know who does not use fluoride has tons of dental problems. And I don't know if this is a coincidence or just the fact that fluoride really does help. It's just my opinion. Again, take it or leave it. I've been using fluoride for 44 years and it served me well. Tip number 5 is for those who want to whiten their teeth. The original crest strips have now been made generic, and while they're still relatively expensive, I think they're also very effective. So I think they are worth the money. I think it's a great invention. I think it's a great implementation, and I would recommend them. I use them once a week, and I've been very satisfied with them, just from me to you. A little bonus tip for today, I do recommend Listerine, particularly the Cool Mint version. It's the older version. I do not like the ultra clean newer version because it tastes too much like chemicals and just is not an enjoyable experience. Which brings up an interesting point. If you're not enjoying your self-care, you're not going to sustain it, and thus you're going to have a bad outcome. So you have to find products that taste good to you and that feel good to you in the moment, and they'll also help you in the future through that sustained use. Let me know if you liked today's video, and feel free to subscribe if you'd like some more health-related tips and tricks in the future. Have a great day. Take care. Bye.